So I'm Nicolas Girerd, I'm a cardiologist in Nancy, France, and I will be discussing the TELESAT results. So the reasoning behind the study is to evaluate how remote monitoring can improve patient outcome. This remote monitoring program, our RMPs, have been implemented in France for a few years now, and we wanted to evaluate how it was associated with mortality. So the patient population was actually twofold. On one hand, there are patients hospitalized for heart failure, and on the other hand, patients thought of having high NT-proBNP, because those are patients that are eligible, according to French law, to remote monitoring. So this was easy in the remote monitoring program patients. It was a little bit more tricky in the controls to assess. So the key results for this study are that there is an association between remote monitoring program based uniquely on weight and symptoms evaluation coupled with tele-education, and it actually was associated with lower rates of all-cause mortality, 35% lower, and it's very significant in this very large study, including almost 20,000 patients. So to impact practice, usually you need randomized evidence. This is not randomized, this is observational, but still interesting real-world data. And this suggests that remote monitoring is associated with lower risk of bad outcome. So it may guide the policies of other countries. Currently in France, it is already reimbursed, but it is actually an exception, I think, in Europe, so it may be helpful to other countries. The size of the reduction in all-cause mortality is a little bit surprising because it seems very large. It is probably because there is not only remote monitoring, it's actually an interface that helps the building follow-up, integrated follow-up for the patient, and this is probably why we have this kind of association. It's probably not just the monitoring itself, but rather the context of it.